It all starts with something so small, so common, a mosquito bite. You barely even notice it. But then, a few days later, wham! The fever hits, your body aches, you just feel completely wiped out. So, you go to the doctor, and that's where a really serious puzzle begins. Is it dengue? Could it be Zika? Or something else entirely? Figuring that out, and fast, is absolutely critical. So today, let's crack open this mosquito bite mystery. And here's the heart of the problem, right? You have a single type of mosquito, the Aedes mosquito, and it can carry 4 major viruses: dengue, chikungunya, Zika, and yellow fever. And in those first few days, they can all look and feel frustratingly alike. So imagine you're a doctor in a packed clinic, maybe right in the middle of an outbreak. How on earth do you make the right call? Just look at this. This table shows you exactly what those doctors are up against. Got a rash? Well, it could be any of the 3. Crazy joint pain? Probably dengue or chikungunya. What about red eyes? Could be dengue, could be Zika. You see the problem, right? This massive overlap in symptoms is why just guessing based on how you feel can be a really dangerous game. And we are not talking about some rare, niche medical issue. We're talking about 3.9 billion people. That's how many people live in parts of the world where these mosquito-borne viruses are a constant threat. It's nearly half the population of the entire planet. The scale is just mind-boggling, and it's why having a clear plan is so incredibly urgent. So, what's the solution when the symptoms are so confusing? Well, it's this: a unified clinical playbook from the World Health Organization. The big idea here is brilliant. Instead of trying to guess which specific virus it is right at the beginning, this guideline gives doctors a single, powerful approach to manage all of them based on one simple question: how sick is the patient? The playbook basically splits everything into 2 clear paths. Path number 1 is for non-severe disease. These are the folks who are sick, for sure, but can be safely managed at home or in an outpatient clinic. And path number 2 is for severe disease. These are the patients who need to be in the hospital for close monitoring and more serious treatment. It's simple, it's clear, and it tells doctors exactly what to do. All right, so let's walk through that first scenario, managing a non-severe case. This is what most people will go through. So if this is you, what are the rules of the road for getting better safely at home? Okay, rule number 1, the absolute top priority is hydration. Now, the WHO calls this protocolized oral fluid treatment, which sounds super complicated, right? But it just means having a simple, clear plan. It means you actually measure how much you're drinking, maybe write it down, and you make sure you're hitting your goals. It's all about fighting off dehydration before it can start. And you might think, how much difference can that really make? Well, the impact is huge. The research shows that for every 1,000 patients who simply follow a clear, written hydration plan, 22 of them avoid a trip to the hospital. Think about that. Just by measuring your water intake, you can dramatically cut your risk of getting dangerously sick. That is powerful stuff. So hydration is locked down. That's step 1. But what do you do about feeling terrible? The fever, the headache, the aches and pains that make you feel like you've been hit by a truck. What you decide to take for that is a really, really big deal. So what's the safe bet for that fever and pain? The WHO guidelines are very clear on this. The recommendation is paracetamol, which you probably know as acetaminophen. It's the go-to because it works well on the symptoms without adding any dangerous risks into the mix. But honestly, what you don't take is even more important. The WHO has a very strong recommendation against using NSAIDs. We're talking about things like ibuprofen or aspirin. And here's why. One of the biggest dangers with dengue is that it can make your blood platelet count drop, which raises your risk of bleeding. Well, NSAIDs mess with your platelets too. So if you take them when you have dengue, you could turn a bad situation into a life-threatening one. Okay, now let's switch gears and look at that second scenario. What happens when a patient gets sicker and they end up in the hospital? The playbook gets a bit more complex here, but the core ideas of careful, thoughtful management are exactly the same. In the hospital, hydration usually means getting fluids through an IV, but it turns out not all IV fluids are the same. The WHO suggests using what are called crystalloids. Think simple saline solution. The other type, colloids, are generally not preferred, because studies suggest they might cause more side effects, like allergic reactions, without really offering any extra benefit. But giving IV fluids brings its own major challenge. It's a clinical tightrope walk. Give too little fluid, and the patient could go into shock. Give too much, and you could overload their system and cause serious breathing problems. So how do doctors nail that perfect balance? Well, they use some pretty clever and often simple clinical tools.
One of the best ones is the capillary refill time test, and you don't need any fancy equipment for this, just a thumb and a watch. A doctor presses firmly on your fingertip, lets go, and then times how long it takes for the pink color to rush back in. If it takes longer than 3 seconds, that's a clue that circulation might be sluggish and the patient might need more fluids. It's simple, it's fast, and the WHO strongly recommends it.
And check this out. Here's another brilliant technique, the passive leg raise. By simply lowering the patient's upper body and raising their legs, a doctor can give them a temporary fluid boost using the blood that's already in their legs. If their heart function gets better during that maneuver, it's a fantastic sign that they'll probably respond well to getting more IV fluids. It's like a test drive without having to give any extra fluid at all. Just genius. Okay, we have covered a lot of clinical ground here, so let's bring it all home. What does all of this mean for you? Let's boil this entire WHO playbook down to the absolute must-know rules for anyone who thinks they might have one of these viruses. So here it is, your personal playbook. 4 key rules. 1. Stay hydrated and do it with a plan. Measure it. 2. For that fever and pain, stick to paracetamol. 3, and this is the big one, it's critical, avoid NSAIDs like ibuprofen. And 4, know the warning signs that mean you need to get to a hospital immediately, things like really bad stomach pain, vomiting that won't stop, or any bleeding from your gums or nose. Honestly, if you only remember one single thing from our time together, please let it be this. Because you can't be sure it isn't dengue at the beginning, staying away from NSAIDs is the single most important choice you can make to keep yourself safe. This unified playbook is a massive leap forward. There's no question about it. But the science never stands still, and the WHO guideline is also a roadmap to the future, pointing out the biggest unanswered questions that researchers are tackling right now. So the next chapter in this fight is all about getting smarter, finding ways to spot high-risk patients even earlier, fine-tuning those fluid strategies in the hospital, and searching for new targeted treatments for the toughest cases, like severe dengue and yellow fever. It's a great reminder that even when you have an excellent playbook, the mission is always to make it even better and to save more lives from the mystery that starts with a single mosquito bite.